video is going to focus on the femur. This is the largest and heaviest bone in the body. We're going to spend the first part of it focusing on getting oriented. So the reason that we know that this is a right femur, we're looking at an anterior view of the femur. One of the best ways to know if you're looking anterior or posterior, first of all, you do not see the linea aspera. That's going to be on the posterior surface. And the anterior surface always has this nice smooth patellar surface on the distal end of the bone. So this is where the patella would sit. So we know we're looking at an anterior view. The femoral head is always going to be medial. So this is what's going to articulate with the acetabulum. So we know that this has to be medial, so this has to be a right femur. Now, if you were to look at the posterior view, there's a lot more going on in terms of the posterior view. You can really see your trochanters, so your greater and your lesser. You're going to have a very thick ridge of bone going right down the middle of the shaft. So this is your linea aspera. And your femoral condyles are much more obvious on the posterior side. So if you're looking at this view, you know that you're looking at the posterior view of the femur. Okay, so we're going to focus on the anterior view and looking at some of the landmarks in this region. As I already mentioned, and it's fairly obvious, this is your femoral head. It's very large, very bulbous. It fits very closely within the acetabulum of the os coxa, or the hip bone. During life, this is completely covered with articular cartilage, except for right here, which is your fovea. This is where that ligament for the head of the femur fits. But everything else in this region during life will be covered with articular cartilage, and that's why this particular area of bone is very smooth right here. Now, right in this area, this pinched-in area right here, is your femoral neck. And this area is very clinically important because this is a very common site in terms of fractures. This is actually the narrowest and the weakest portion of the femur. So it makes sense that this area is often fractured, particularly in individuals with osteoporosis. So the bone's already weakened by osteoporosis. When you hear the term hip fractures, it very rarely indicates a fracture of the os coxa, or the hip bone. It generally is a fracture that occurs right here in the neck, or sometimes in the femoral head. So that hip fractures, or hip replacement, will generally happen in this region right here. So as we remember, your medial femoral circumflex artery is going to supply the neck and the head. So if you have a fragment in these regions, it could disrupt the supply of the medial femoral circumflex. Okay, now moving laterally, you can see some of your greater trochanter right here. The term trochanter is specific to the femur. You will only hear the term trochanter when talking about the femur. It's basically just a very large tubercle, a very large area in terms of muscle attachment, cause the bone to get large. So you can see the greater trochanter in a lateral view right here. But if we flip over and look at a posterior view, you can see a bit more of your greater trochanter right here. So this is a very important insertion site. So your gluteus medius, your gluteus minimus, piriformis, your gemelles, as well as your obturator internus are all going to insert on this area. So no wonder that this is so large. That's why it's your greater trochanter. So lateral, always opposite to your femoral head. Now on the posterior medial surface, so we know we're posterior, and this is medial right here. This is your lesser trochanter. So this is the insertion site for the common tendon of psoas major and iliacus. So your iliopsoas muscle or tendon is going to insert here. So lesser trochanter right here. Now you can see this ridge of bone that is going to run between your lesser trochanter all the way to your greater trochanter. And this is your intertrochanteric crest. Whole area right here. This is where your quadratus femoris is going to insert. So this is why you have this crest of bone right here. Now if you look right in this region, you'll see a fossa, a very obvious fossa right here. This is going to be on the medial side of your greater trochanter. So looking kind of at the posterior surface on the medial side of the greater trochanter. Basically where the greater trochanter is meeting the neck. This is referred to as your trochanteric fossa. And this is where your obturator externus is going to insert. So right here is your trochanteric fossa. Okay, moving distally, we're going to focus on the shaft region or below your trochanter region. You're going to have a very obvious and distinct line referred to as your linea aspera. So a vertical ridge on the posterior side of your femoral shaft. This is an important insertion site, so your adductors or your adductor magnus, adductor longus, and adductor brevis are all going to insert on your linea aspera. It's also the origination site for vastus intermedius and your short head of your biceps femoris. So very important region right here in the middle of the posterior shaft. Now looking back superiorly, you're going to have a line right here and then a line or a tuberosity right here. So the first one we're going to focus on is your pectineal line. So basically, you'll look at your lesser trochanter, and you're going to follow a ridge of bone down to the linea aspera. So this is your pectineal or pectineal line. And as the name would indicate, this is the insertion site for your pectineus or pectineus muscle right here. So this is going to be the more medial of the two lines. Looking more lateral, and on this particular specimen, it's been painted black. This is your gluteal tuberosity. So roughened area, you're going to go from the base of the greater trochanter down to the linea aspera, and this is your gluteal tuberosity. So this is one of the insertion sites for your gluteus maximus. The other is going to be your IT band. And sometimes this can become so large that it becomes a true tuberosity, looks fairly similar to the lesser trochanter. Not often, but occasionally. Okay, now we're going to move back to the anterior surface and look at the more distal region of the bone. So we're going down to the condylar region or articular surfaces in this region. So you're going to have, as you did in the humerus, you're going to have two epicondyles, and this basically means just above the condyles. So you can see the condyles in this region. The epicondyles are going to be superior to those. So the medial epicondyle is generally the larger of the two. It's going to be on the same side as the femoral head. This is going to be the attachment site for your tibial or medial collateral ligament, so important in terms of your knee joint. On the lateral side, this is going to be the smaller of the two, smaller than the medial epicondyle. This is going to be the attachment site for your fibular or lateral collateral ligament. It's also an origin site for your popliteus muscle. Now on some specimens, it's more obvious than others, but superior to the majority of your medial epicondyle, you sometimes will have a projection, more obvious in some individuals than others. This isn't particularly obvious on this specimen. But this is what's referred to as your adductor tubercle, or adductor tubercle, projecting superior to your medial epicondyle region. And this is one of the insertion sites for your adductor magnus. So adductor tubercle right here. As we mentioned before, this is your patellar surface, very smooth. One of the ways you can tell you're looking at the anterior surface of the femur, and your patella would sit here during life. Now flipping back over to the posterior view, because it's more obvious in terms of your condyles, you can see these nice bulbous femoral condyles, which are going to articulate with the tibial condyles. This is going to be the medial. It's on the same side as the head of the femur, and this is going to be your lateral condyle. So these are going to articulate with the menisci and the tibial condyles of the tibia. Now, if you were to place the condyles on a flat surface, so on a horizontal level when your bone is in anatomical position. If you put the condyles on the table, the femoral shaft will assume the oblique position that it occupies in a living body. So you can see that oblique position of the condyle, or of the femur, I'm sorry. Now, putting this back down, lastly we're going to talk about the patella. So this small little bone right here, this is a sesamoid bone. So sesamoid bone just means that it forms in a tendon. So your patella is going to form in the tendon of your quadriceps femoris. It's going to articulate with the patellar surface of the femur. The point is going to face down. So the point of the patella is going to face down. This provides a protective function for the femur from the grinding forces that can occur with the quadriceps femoris tendon region. So this is all you really have to know about the patella, basically being able to identify